Today I'm going to speak about physical activity for primary prevention of cancer. So physical activity is defined as any movement that uses skeletal muscles and requires more energy than resting. So this is as distinct from exercise, which is defined as a subset of physical activity that is planned, structured and done repeatedly to improve or maintain physical fitness. Physical activity can be classified by intensity, so light, moderate or vigorous, and intensity is sometimes stratified according to metabolic equivalents or METs. So a MET is a unit used to estimate the amount of energy expended during physical activity relative to resting metabolic rate. So 1 MET is the energy cost of sitting quietly, and it's roughly equivalent to consuming 1 calorie per kilogram of body weight per hour, or 3.5 milliliters of oxygen per kilogram of body weight per hour. So light intensity activities like slow walking are typically less than 3 METs. Moderate intensity activities like brisk walking are usually 3 to 5.9 METs. And vigorous intensity activities such as running are typically greater than or equal to 3 METs. So what is the evidence base for the association between physical activity and cancer risk? The information in this presentation is based on the 3 syntheses of the evidence on physical activity for cancer prevention that you see here on the slide. So on the right is the World Cancer Research Fund and American Institute of Cancer Research expert report, which provided an expert synthesis of the evidence in 2018. The American College of Sports Medicine published the findings from its roundtable exercise to evaluate the evidence on physical activity and cancer prevention in 2019. And on the left, you can see the World Health Organization's International Agency for Research on Cancer, IARC, synthesized the evidence in the chapter on physical activity, sedentary behavior and obesity, which was published in the World Cancer Report in 2020. Research on the association between physical activity and cancer began to emerge initially in the mid to late 1980s. So the early studies focused on athletes and their risk of cancer over a lifetime, as determined through long-term follow-up. In the 40 or so years since, a large body of evidence has amassed. So at the time of publishing the World Cancer Report in 2020, more than 450 observational epidemiological studies had been published that had examined some aspect of physical activity and the risks of developing cancer. And dozens of meta-analyses and systematic reviews had examined the associations for specific cancer sites. In 2016, a pooling study coordinated by the United States National Cancer Institute examined the association between physical activity and cancer for 26 cancer sites by analysing data from 1.44 million participants across 12 large prospective cohort studies from the USA and Europe. In the past 20 years or so, there has been a focus on how sedentary behaviour, independent of physical activity, is associated with cancer risk. So for practical and ethical reasons, it's not really feasible to conduct randomized control trials to evaluate modifiable risk factors for cancer like physical activity. But RCTs have been carried out to investigate how physical activity influences biomarkers hypothesized to be associated with cancer risk. So the evidence to date has shown that physical activity is associated with a reduced risk of at least 13 types of cancer. So there's strong evidence that physical activity reduces the risk for cancers of the breast, colon, endometrium, bladder, kidney, stomach, and esophagus, so specifically adenocarcinoma of the esophagus. And there's moderate evidence that physical activity reduces the risk of lung cancer. However, with lung cancer, there are concerns around smoking status as a confounding factor. There's limited evidence that physical activity reduces the risk for cancers of the prostate, ovary, pancreas, mouth, pharynx, and larynx. So what about the relationship between sedentary behaviour and cancer risk? So sedentary behaviour is defined as any waking behaviour characterised by an energy expenditure less than or equal to 1.5 METs while in a sitting or reclining posture. So examples include obviously sitting while using a computer, watching TV or reading, or sitting while commuting. And sedentary behaviour is distinct from physical inactivity, as you can meet the guidelines for moderate or physical activity and still spend most of your day sitting. And a growing body of evidence demonstrates that prolonged sedentary behaviour is associated with increased cancer risk independent of physical activity level. Emerging evidence suggests that sedentary behaviour is associated with an increased risk of cancers of the breast, colon, endometrium, and lung. So the World Cancer Research Report describes the evidence for these 4 cancers as limited. And a more recent systematic review and meta-analysis, which was carried out by Hermlink et al. In 2022, which included more studies, found that there was actually no statistically significant association between sedentary behaviour and lung cancer risk. So is it possible to mitigate the risk posed by sedentary behaviour? So there aren't many studies that answer this question with cancer incidence as an outcome. But in terms of mortality, according to a meta-analysis of data from over 1 million people, which was published in The Lancet in 2016, the magnitude of increased risk for all-cause and cancer mortality with increased sitting time is attenuated in physically active people. Um, and those in the most active quartile in the study, so people who engage in moderate intensity physical activity for 60 to 70 minutes per day, have no increased risk of mortality, even if they sit for greater than 8 hours a day. So, in fact, those in the most active quartile in the study who sat for more than 8 hours a day had a significantly lower risk of dying during follow up than those who sat for less than 4 hours per day but were in the least active quartile. Excess mortality was cut by approximately 50% in those engaging in moderate intensity physical activity for approximately 25 to 30 minutes per day, which is in line with the Irish and WHO physical activity guidelines. So risk is attenuated but not entirely eliminated. And then what about breaking up sedentary time with light physical intensity activity? So there's very little direct evidence that breaking up sedentary time reduces cancer risk, but we do know that it affects metabolic pathways that are implicated in cancer development. For example, it improves insulin sensitivity and it reduces inflammation. So how much does physical inactivity contribute to the burden of cancer? A study published in the IMJ in 2020 found that from 2011 to 2015, inadequate physical activity resulted in 1,500 cases of cancer, so that was 5% of the total, and 500 deaths, so 6% of the total deaths. And this equates to 300 cases per year and 100 deaths per year. So only colorectal, breast, and endometrial cancers were considered, which has been typical of previous studies of this kind based on the understanding of the association between physical activity and cancer at the time. As we now know that there are established relationships between physical activity and at least 13 types of cancer, this study is likely to have significantly underestimated the true burden. So further studies will be necessary to estimate the burden in light of the expanding evidence base. There are several hypothesized biological mechanisms involved in the association between physical activity and cancer risk, and randomized control trials have demonstrated direct effects in several of these, so including reduced adiposity. So we know that living with obesity increases the risk of at least 13 types of cancer. Improved metabolic function, so improves insulin sensitivity and lower circulating insulin and insulin-like growth factor. And we know that both insulin and insulin-like growth factor can stimulate increased cell proliferation and inhibit apoptosis or programmed cell death. A reduction in chronic low-grade inflammation and a reduction in circulating sex hormones, which are implicated, for example, in breast and endometrial cancers. So this means that biological plausibility exists for the association between physical activity and cancer risk, which significantly strengthens the evidence. Other hypothesized mechanisms under investigation include improved immune function, um, improved gut motility, which reduces contact time between potential carcinogens and the intestinal epithelium, and a reduction of oxidative stress, which we know can cause chromosomal abnormalities, DNA damage, and mutations in tumor suppressor genes. So what do we know about the dose and type of physical activity required for cancer prevention? There's consistent evidence that for a dose-response relationship between increasing levels of physical activity and decreasing cancer risk. There's evidence that physical activity is equally beneficial for men and women for cancers of the colon and the kidney. There's limited evidence that effect modification by sex may exist for other cancers such as bladder, gastric, cardia, lung, esophagus, and pancreas. There's insufficient evidence to determine whether the association between physical activity and cancer incidence varies by age or socioeconomic status, and some limited information suggests that the benefits appear to be equal for all racial and ethnic groups. It's not currently possible to determine the exact levels of physical activity needed to provide benefits in reduced cancer incidence for any particular cancer site, and the evidence base has historically been dominated by studies on aerobic exercise, so our understanding of the benefits of resistance training is limited and requires further study. So, in summary, we know that physical activity, aerobic activity specifically, reduces cancer risk, but it's unclear what the optimal type, frequency, intensity, and duration of physical activity for cancer prevention is. So this is taken from the American College of Sports Medicine's Roundtable report, and it illustrates the dose-response relationship between physical activity and cancer. They looked at hazard ratios for 10 cancers from meta-analyses from a review of the evidence carried out by the Physical Activity Guidelines Advisory Committee in 2018, and those are shown in by the black dots, and hazard ratios from the pooled analysis of 1.44 million participants by Moore et al., which I mentioned earlier, and those are shown by the open triangles. So you can see that there is consistency when you compare the results from the meta-analysis to the pooled analysis. The magnitude of risk reduction varied from 10 to 24% when the highest versus lowest levels of physical activity were compared. And you can see that in addition to the cancers that I've already mentioned, liver cancer is also listed here. So the pooled analysis found that higher levels of physical activity were associated with a 36% lower risk of liver cancer compared with lower levels of physical activity. The Physical Advisory Guidelines Committee report didn't include a meta-analysis for liver cancer, so the ACSM concluded that physical activity may protect against liver cancer. You'll also see that melanoma is included. So the pooled analysis found that there was a 27% increased risk of melanoma associated with higher levels of physical activity compared to lower levels. Historically, several cohort studies and meta-analyses reported a positive association between physical activity and melanoma risk, but this association has primarily been attributed to outdoor activities that may expose the skin to UV radiation, which is obviously a key risk factor for melanoma. So awareness of physical activity as a risk factor for cancer amongst the general population is very low. In the National Cancer Survey on Cancer Awareness and Attitudes in 2022, only 1/3 or 33% of participants spontaneously identified low levels of physical activity as a risk factor for cancer. And in keeping with these low levels of awareness, the number of people getting adequate physical activity is also low. So in Ireland, the National Physical Activity and Sedentary Behaviour Guidelines, Every Move Counts, are met by only 1 in 4 primary school children, 1 in 8 teenagers, and 4 in 10 adults. So how much physical activity should people be doing to reduce their risk of cancer? Everyone should follow the National Physical Activity and Sedentary Behaviour Guidelines for Ireland, Every Move Counts. There are different recommendations for different age groups. But so, for example, for adults aged 18 to 65, it is recommended that they get at least 2 hours and 30 minutes of moderate intensity aerobic physical activity, or at least 1 hour and 15 minutes of vigorous intensity aerobic physical activity throughout the week. Additional muscle strengthening activities at moderate or greater intensity that involve all major muscle groups are recommended on 2 or more days a week. Limiting sedentary activity is also a key recommendation across all age groups. So the guidelines recommend limiting sedentary time and time spent sitting and replacing it with any type of movement or physical activity. But the key message is that any activity is better than none, so every move counts. So what are the key take-home messages? So physical inactivity is a modifiable risk factor for cancer. Physical activity is associated with a reduced risk of at least 13 types of cancer, and sedentary behaviour has been identified as an independent risk factor for cancer. Everyone should meet at least the minimum levels of physical activity set out in the National Physical Activity and Sedentary Behaviour Guidelines, Every Move Counts. We know that there is a dose-response relationship between physical activity and cancer risk, so every move counts, but more is better. People should aim to limit sedentary time and interrupt it with short bouts of light physical activity where possible. Those with high levels of sedentary time should aim for even higher levels of physical activity, so in the region of 60 to 75 minutes of moderate intensity physical activity per day. And finally, you should always protect your skin when exercising outdoors. So thank you for your attention, and I'd be happy to take any questions that you may have.